Welcome all of you. Actually, today the point which I just wanted to highlight is that because anesthesia is a specialty which has so much multi dimensions that it's very difficult to cover from one book. Okay, and actually because some of the specialities have a limited domain, but anesthesia has such a wide and broad domain that unfortunately I don't think so. There is any single book like some of the specialities have that which is covering their domain. Okay, so I will just try to just have few words that how as a resident or if you are preparing for any exam or even when have you have already passed your exams and now you just want to improve your knowledge and improve your skills and have some more detailed information about a specific topic. So I just want to share my ideas about how we should actually study with reference to anesthesia. Okay, so I will just divide the topics which you should target in few ways. That one of them will be various diseases. Okay, I will tell you in detail how to target one specific disease. Number two will be equipment because in anesthesia there is a wide range of equipment you should be knowing about. Then third thing will be various surgeries and concerns with reference to various surgeries. And the fourth thing will be critical incidents, okay? Or you can say that uh, complications or immediate management with reference to like for example hypotension, bradycardia, tachycardia, um, bronchospasm, laryngospasm, things like that. Okay. And the fifth thing will be because it's a very wide range of things which are related to it. So I will just make it a separate, but though it is pharmacology and physiology actually can be covered with reference to diseases. Okay, and the last thing will be miscellaneous, which are not covered in these headings. Okay, so first of all, I will just start with diseases, and I will just get the help from one of the file which I made. Uh, all of this is available for your access for all of you. Just a second, please. Okay. So actually, whatever disease you are reading, because one way will be that you are opening a book and you are trying to read a disease, but that will not cover your target. Okay, and it will just lag a lot. Okay. So the better way will be that what is the main category of that disease, and if, for example, like I give you example of myasthenia gravis. Okay, so myasthenia gravis is a disease for which you should be knowing how the nerve transmission occur at neuromuscular junction. Okay, and it's sort of muscle weakness. So you should be knowing what are different causes of muscle weakness. If you want to learn in a better way, first of all you should be knowing how the nerve uh, transmission occur at neuromuscular junction and from the brain to the muscle activity. So you will understand it in a better way because, for example, neuromuscular junction, post synaptic disease is myasthenia gravis. Pre-synaptic disease, for example, is Eaton Lambert. Okay, and then there on you will be knowing where is the involvement of polio, where is the involvement of multiple sclerosis, because in all these there will be some problem in the muscle contractility or like similarly muscular dystrophies. So if you understand, if you want to have a good grip, you should be starting from the basic physiology, and then you can know that what exactly is the pathology in that disease, and then you will, because all of thing will be basis on that thing. Because if then if you understand, then if someone is telling that in myasthenia gravis there is sensitivity to atracurium and resistance to succinylcholine, you already know that there is no acetylcholine receptor, so succinylcholine resistance is there, because succinylcholine is a depolarizing muscle relaxant and it needs receptors to be there for its effect. Okay, so this is, I'm just giving you one example. Then like what is the main domain of the disease? Like myasthenia gravis is an autoimmune disease, so whenever there is one autoimmune disease, you should be looking for other autoimmune diseases. Okay, and then similarly you will be looking at which are the systems involved. This format you can put it in any disease. Okay, this format you should put it in any disease, and usually you some systems will be of your interest, like with reference to anesthesia. Airway is very important. Cardiovascular system is very important. Respiratory system is very important. All the drugs are dealt by liver and kidneys. Okay, so you will be targeting then the hematological system. So if you just make it in an organized way, rather than reading a page of a book for the reference to a disease, try to find out the answers, that what is the involvement of liver in certain disease, on kidney in certain disease, how, like even in myasthenia gravis you can have some involvement with reference because in myasthenia gravis the patient may be receiving steroids and immunosuppressants, and there may be other autoimmune disease. So this will be involving the multi-systems. Okay. So you should be knowing that the patient taking steroids, what can be the systemic effects? Patient taking immunosuppressant, what can be the systemic effect? So like you can fill in the gaps. Okay. Similarly, airway, cardiovascular system, respiratory system. So I have just made it a format. You can put it any disease in that format. So then you can have like acid base, electrolyte, fluid, like for example any disease involving albumin. So or plasma proteins, the free drug will be more. When there will be more free drug, there will be more effect. Okay, so like you just have to correlate the clinical findings of that disease, and you will should, because in that way you will not miss anything. Okay, similarly the whole of our anesthesia management goes around what are the cardiac risk factors, what are the pulmonary risk factors, what are the renal risk factors, with reference to aspiration risk, PONV risk, airway management problems, or any specific or special monitoring you need. Okay, and like for example any disease in which there is some bone marrow involvement, there is anemia, or there is something like that, you should be thinking about it. Okay, so there will be some problems which will be acute, and there will be some problems which will be long term. Okay, so patient taking steroid, maybe one single dose is not doing much harm, but if the patient is on steroids for a long time, then there will be more systemic effects. Similarly, patient with any joint disease, patient taking NSAIDs, so you will find, and the effects of NSAIDs and in the form of renal failure or in the form of ulcers or things like that. Okay, so you just have to use your intelligence to, rather than reading blindly, you fit it any disease in this one. Okay, and then whatever is the result, you have to just um, uh, manage your anesthesia management, and then again think about pre-medication, think about special monitoring. Like with reference to myasthenia gravis, you will be thinking that you need to monitor the neuromuscular stimulation in addition to standard 1 and standard 2 monitoring. Okay, if you are doing certain, in every disease you will, like for example if you have a patient with COPD, in addition to standard 1, standard 2 monitoring, you will have more focus on the airway pressures. This was one example. If a patient having some renal risk, you will be looking at urine output. Okay. So like this is how you should be targeting any disease. Okay. So, and the medications patient is taking, there will be some side effects, or again, you can put it in the systems where you are, which are at your business end. So any disease, now try to read it in this sketch rather than reading blindly. Just try to put these headings, and then you will be able to see what are the systems involved, what are the risk factors, what these risk factors are changing your anesthesia management, your anesthesia medications. So you will be modifying accordingly, and then you will be looking that any optimization you can do. Can you mute your mic, please? Okay. Any optimization you can do. Okay. And if there are some risk, you will stratify the risk as much as you can, as much optimization you can achieve, and then you will be anticipating accordingly. Like for example, if you have a patient in which there is some involvement with reference to respiratory system, and you think that post-operatively there may be some depressed respiratory reflexes or respiratory function, so you will be anticipating accordingly, and you, for example, you will be arranging HDU or ICU. Okay, you will be arranging things like that. So that is the word anticipation of complications. And then you will be planning all the anesthesia steps according to the findings you have in the disease. So whatever you are reading, try to just correlate what will have this problem or this finding or this effect affecting your anesthesia management, because ultimately you have to, and actually this is the problem which you don't that's why people fail in the exam, because if you are not able to correlate these things, you have just read the findings and you don't know how to correlate. Like, for example, if the patient has some problem in which there is involvement of cardiovascular system, a patient has taken chemotherapy, and now you did not correlate what will be the effect. So actually, chemotherapeutic agents can have depressed cardiac function. So you are doing echo just to see is there any interval change in the cardiovascular system. What about the systolic and diastolic function? So if you don't correlate these things, maybe you are not doing, you are missing it. You can only check if you know. So any patient word chemotherapy comes, you will see the effects on bone marrow, the effects on renal system, the effects on cardiovascular system. Some of the immunosuppressant and chemotherapeutic agents have some effect on the respiratory system as well. Okay, so this is how you will be correlating the disease, the involvement, and then as I told you, that you can bring physiology and pharmacology here as well. Okay, you can read the respective physiology part of with the clinical relevance, then physiology, pharmacology, and even if there is some anatomy, you can just put it and in that disease. Not every disease will have that much dimension, but some of the diseases are very important because it will cover all a number of systems. Some of the diseases like rheumatoid arthritis is a disease which will be involving a number of systems. Sickle cell disease, though it is only involving the hematological system, but the effects of sickle cell crisis or sickle cell disease is on all the systems. So that will be diseases in which you can understand all the systems. Similarly, if the patient has liver disease, it will have involvement with the cardiovascular system, it will be involved with the renal system. So if till the time you don't correlate these things, because this is the main problem which you will face if you are reading it from a single book, because not single book will be able to cover the all the dimensions of that disease. So that's why review articles are much better source than any, you name any book, it will not be covered. So the review articles will be much better. No, though no, not one single article will still be sufficient. You might need to have more than one articles related to that subject, and then you will be able to be confident that you can do it. Okay. So this is the first step in your management. The second step will be with reference to surgery. Okay. So if for example, then the point which I wrote with reference to surgery, whenever you listen a word surgery, you just have to fit in these things, and then with reference to the, of course, the diseases. Okay. what is the first thing you have to see, what is the urgency of the surgery. If any surgery which cannot be delayed, all the medical factors will remain there, but you will have to proceed with risk stratification, minimizing and the things which can exaggerate that medical problem, monitoring in that way, and finding out the way in which you can keep your patient alive or decrease the mortality or morbidity. That will be your aim, because the surgery is urgent and you cannot delay it. Yes, there is a little bit differentiation between an urgent surgery and an emergent surgery. Usually, emergent surgery are the one which are the most, like for example, fetal bradycardia, like firearm, like patient having expanding hematoma for any reason, even in the brain or something. Okay, so the surgeries which cannot be delayed for more than minutes, I will consider them as emergent surgery. Like for example, incarcerated inguinal hernia, for example. Okay, because it will cause gangrene. For example, there is a limb ischemia, and you have to do the surgery within minutes. Otherwise, the patient will lose the limb. Okay, so these will be the surgery which are emergent. The next step will be urgent surgery. So, sorry, yes, urgent surgery. Like example will be appendix. Appendix is not emergent surgery usually, unless it has been ruptured and it is causing septicemia. Otherwise, you can have some few hours. So minutes will be emergent, hours will be urgent, and then the third category will be planned surgery. Okay, like planned surgery will be like I give you an example of planned surgery which actually is not elective, is, for example, cholelithiasis and cholecystitis. Okay, you can, it's not emergent, it is not urgent, it is not even elective. It comes in between. You can have few weeks and you have to do it. Okay, otherwise, if you keep it for long, maybe gallbladder can rupture, there may be empyema, there may be slipping of the gallstones in the biliary tract, and the patient then will be having a jaundice, and then it will become an urgent surgery. Okay, so you just have to correlate the example of pure elective surgeries as cosmetic surgeries and things like that. Cosmetic surgery, joint replacements, though those are the surgery which are purely elective. Okay, otherwise rest of the things are like orthopedic procedures are never elective. Orthopedic procedure except joint replacement, like fracture cannot be there, because they put it in elective list, but they are delaying it, for example, for some reason they have put the cast, or they have done some minimum procedure, and now they are replacing it. So even that case should not be said as elective, it is sort of planned. Okay, so this is just related to the urgency of surgery. This is one thing. Then you have to rule out according to American Heart Association, there is the classification according to the surgical risk: high risk surgery, intermediate risk surgery, low risk surgery. So you just have to see whether it is high risk surgery, intermediate risk surgery, or low risk surgery. Like low risk surgery are superficial surgery, breast surgery, not cancer with axillary dissection or things like that. In intermediate risk surgery are laparotomy, thoracotomy. Okay, the high risk surgeries are, for example, liver transplant, or emergency surgeries, or aortic surgeries, vascular surgeries. These are considered as high risk surgery. Okay, you can have a on the list. So this will be second thing. Third thing will be bleeding risk. There may be a minor surgery, but you are at a place where there can be sudden bleeding. The example will be, for example, you are just doing incision drainage, but in the inguinal area where there are major vessels are near. So there are chances that you happen to nick them. So although this is a low risk surgery, but it can have high risk of bleeding. Similarly, for example, this lap sleeve gastrectomy or even laparoscopic cholecystectomy, they are intermediate risk because they are involving the cavities, abdomen, but they are a high risk for bleeding, because if there is very near, there are major vessels, and somehow it can nick, so there is high risk of bleeding. So in these surgeries, you anticipate that suddenly patient can bleed. So it's like I always suggested this to people that whenever you are doing laparoscopic surgery, should have good IV access, because suddenly patient can bleed, and in this case you cannot suddenly immediately control the bleeding till the time they open it. Okay, so that's why this is a concept. That's why I have written it at separately. That surgical risk is something else and bleeding risk is something else. Patient, for example, is on any medications which are causing any anticoagulation or antiplatelet effect. So now the patient is at bleed have any surgery will become having high bleeding risk. Okay, so this is the concept. Then other thing will be, you should be always looking which patient position you have. Like, is it a lithotomy position or prone position or supine position or lateral position? So there will be a lot of concern which will be reference to the position. Then usual duration, you have to plan your anesthesia accordingly. Level of anesthesia or level of incision required, because that for that you need to know every surgery. You should put in every surgery, should put which anesthesia level you want. Like, for example, if you have a laparotomy, midline incision ranging up to this Xiphi sternum, you need the Xiphi sternum is T6. Okay. So the incision required is up to the level is T6. But if someone asks you, the answer will be T4 autonomic, because the mesentery can go up to T4. Okay. So things like that, you should be knowing the level of incision required. You should be knowing. Okay. And then some surgeries may be done in general anesthesia, some can be done in local anesthesia or regional anesthesia or blocks or things like that. Okay. So you should be knowing which are different options of anesthesia you can have for that surgery. Possible anesthesia option, possible analgesia options, potential concerns and complications, specific age group prone for that surgery. I will just explain to you with reference to any critical step. For example, if you are doing a case of even only anal procedures, but when they are in a place where they are stimulating or they are doing any dilatation, similarly cervical procedure, so cervical dilatation or anything in which the basic vagal stimulation is there, like a procedure with reference to eye. So suddenly this is a critical step. So whenever they will do it, patient can go in severe bradycardia. So this is sort of critical step. Similarly, when they are insufflating gas in laparoscopic surgery, this is a critical step, because patient can suddenly go in hemodynamic instability. Okay. So any surgery, you should be knowing what are the critical steps. Patient in which there is aortic clamping or cross clamping, there will be risk with reference to hyperperfusion of kidneys or spinal cord. So that will be a critical step. Okay. So any surgery, you just try to like, for example, patient having tourniquet, so placement of tourniquet is a critical step. Okay. And opening of tourniquet will be a critical step. So you have to act accordingly. And you are making a position, like you are making a lithotomy position or bringing it down. This is a critical step. Maybe in normal patient there will be not much of the response, but in any patient with limited cardiac reserve, even this one can collapse the patient. Okay. Patient in which they are using bone cement, this is a critical step. So you can just think, is there any surgery, you just think, is there any critical step? So if there is any critical step, you have to be careful at specifically at that time. Okay. Specific age group means, for example, hip fracture. Other than trauma, it will be usually will be in old age patients who fell down. We have weak bones, or any patient who are on steroid having osteoporotic bones, or patient have bone metastasis. So these will be the patient group or patient age group which are prone to that thing. Okay. So similarly, there will be certain procedures which will be more common in pediatric population or more common in, for example, like you just have to think that pregnant patient, elderly patient. So you just have to just think about it, that these procedures, specific age groups are prone to it. Okay. So this is just with reference to surgery. The third thing which I just told you was with reference to physics and equipment. So with reference to physics and equipment, remember one thing, that all equipment, Okay, all equipment, whatever you are dealing with, you should be knowing what is the working principle. Okay, what is the working principle of that equipment you are using? No, number one. Number two, what are different components? Okay, what are different components? Then how it works, like you can say how it is interpreted. Okay, interpreted. And then like what are the like troubleshooting? What is the troubleshooting? And for example, what are the limitations? Okay, and you can say what are the uses. So for example, you can put any equipment which is there, like for example, pulse oximeter. What is the working principle of pulse oximetry? Okay, it is having oximetry and plethysmography. What are the components? There is a light beam and there is a receiver. It is taking it, and then in according to the oximetry and plethysmography, it is measuring it. Okay, different types of pulse oximeter. Then you will be interpreting the saturation levels and troubleshooting that, like in cold, if the peripheries are very cold, it will not work. If there is some hina, that will not work. Different types of patient, you will have problems. So like, what are the limitations? It can only measure two types, wavelengths. Okay, so uses, it is basic monitoring. It has to be there for all patients, whether they are local or general anesthesia. So I'm just giving you one example. So instead of reading all the details, if you focus yourself, and you can put this thing in all, like uh, vaporizer,
एसी चला रहे हो मतलब
pulse
अब
oximetry,
चल रहा है इंग्लैंड में ठंडा है ओके
pulse oximetry, end-tidal CO2, vaporizer, anesthesia machine, scavenging, humidification. You can make a list, okay, and then you can take one by one. So that will be one of the most important component for you. But try to correlate clinically, because whenever you are trying to read something only with for the sake of that topic, maybe you are not able to understand. Okay, like for example, if you are doing gas laws, you should be just correlating them, that for example, Boyle's law, so it is for the cylinders. Okay, to measure the empty cylinders. So similarly, I'm just giving you example that how you should be targeting. So for all anesthesia equipment, with refer even defibrillator, you can make list of electrical equipment: defibrillator, diathermy, radio frequency ablation, cryoanalgesia. Okay, like PCA machine. Uh, like you can make a list, infusion pumps, level one infuser. So you can make a list and do one by one. Okay, so that is that is how you should be targeting it. Then some, because we have already taken a lot of time, I just want to finish in few minutes. Like critical incidents. Okay, the another component which I told you that you should be knowing, that how different, what you should be doing in different various critical incidents. The first thing which will be common for all of them will be call for help. Okay, call for help, and then your approach will be airway, breathing, circulation, that you will be make sure patient airway is patent, patient is breathing well, patient blood pressure is there and circulation is there, or IV lines are there. This will be in any critical incidents, this will be the basic thing. Then you will be maybe stopping something. Okay, for example, local anesthesia toxicity, you have to stop if the medication is going on. Similarly, if blood reaction has occurred, or any medication antibiotic has, you have to stop. Okay, stop the surgeon, stop the triggering agent with reference to that. So for all of these things, this is the basic approach. And then your further approach, further management will be according to the situation. But the basics thing will be, and actually, even before that, you can anticipate. Okay, like if you are anticipating any problem, so the your response may be different. If you are, and like any surgery in which you are doing using the surgeon is using bone cement, or you are giving blood transfusion, you should be anticipating that any reaction can occur. So you will be anticipating accordingly. So now you can have a list of all the complications. Hypertension is a complication, hypotension is a complication, bradycardia, tachycardia, and so on. So then your approach will be accordingly. Like you okay, even if you, for example, patient has high airway pressures, your approach will be the same. Then you will be making sure you will be trying to put the patient on spontaneous ventilation. You will be seeing whether the tube is kinked, or circuit is disconnected, or patient is breathing, anesthesia is not adequate, analgesia is not adequate, there is some problem in the one way valve or things like that. And then you will be your management, resuscitation, management, evaluation will go side by side. All complications, the main approach is the same. You will be resuscitating, evaluating, managing according to the situation. Okay. And your basic approach will be airway, breathing, and circulation. And then rest of the things. You will be stopping something, and then you will be anticipating. So this is the basic principle. Same thing will be with malignant hyperthermia. Same thing will be any other critical incidents you have. Pneumothorax, pulmonary embolism. Okay. So this is, I just wanted to tell you that what is the basic approach, how you should study, because unfortunately, there is no specific single book in which you will be able to find all these things. Okay, that makes our specialty very challenging one, because like one of the equipment I told you is MRI, for example. You should be knowing about MRI, how MRI works, because if you don't know what is the working principle of MRI, or what is the working principle of ultrasound, your knowledge will be incomplete. You should be knowing what is working principle of ultrasound. You should be knowing what is the working principle of MRI. Similarly, laser. Okay. So then you will be looking at the precautions and everything. So actually, that's what my aim was. Anyone wants to ask any question? Okay, my dear. Thanks a lot, all of you, for your presence. Jazakallah. Thank you. Bye bye.